My name is Sandy Wiggs. I'm from Greencastle, Indiana, and I have breast cancer. I've been married for almost 35 years now. My husband, his name's Ben. We have two children who are 29 and 32, and they both live very near us, and we have 5 grandchildren. I like to garden, like flowers a lot, and plants of all kinds. We have also a little vegetable garden. I also like to hike, and I also do biking, walking, any kind of outdoor activity like that. It started in August of 2017. I have regular mammograms at our hospital, and I was having my normal mammogram, but it was the first time that the 3D mammograms were available at Putnam County. Dr. McFall called me into the exam room, or where they look at the x-rays, and he said he noticed something that was different from last year. He showed me where it was, and he recommended having a stereotactic biopsy. And within a couple of weeks, I went to have that stereotactic biopsy. The nurse navigator, or the nurse that was the coordinator there, she said if she phones me about the biopsy, then it would be negative. And if somebody else phones me, it wouldn't be. So somebody else phoned me. And so, I said, well, okay, here we go. And that just began the process. The stereotactic biopsy was a needle tip biopsy, so small. And apparently it was suspicious. They recommended a lumpectomy, or a excisional biopsy. And that confirmed that it was ductal carcinoma in situ.
Oncology and the word cancer has a stigma attached to it, and when you are treating patients, the word cancer basically takes their breath away. So as a patient, if I'm here, I would, after our visits initially and during our treatment, they have a peace of mind that they are getting the best treatment available at their own city or location, with access to other areas if they need to be.
Dr. Ahmed, explained what it would entail and what he would do and what the near future would look like with the chemo treatments.
We can have them undergo these procedures at the specialized centers at Franciscan, where we have quite renowned physicians and availability of clinical trial that we can use.
From the moment you hit the desk to the moment you go back to the back and start your infusion, they explain everything, and they're gentle, and they, ask you how you're doing, and they talk about your family, and of course I know a lot of them, so it felt like home, and I love that. I love I love being able to be with them. Well, the partnership between Franciscan and our hospital, Putnam County, I think was huge. It has blessed us immensely. They know they have their doctors and their nurses and their environment that they're used to and comfortable with. Combining that with the knowledge and the experience and the technology, and I think it's a great thing. It's a great combination of local and city. And so my spiritual journey was even more so than the physical. No matter even if this didn't work, I was okay, that I knew that God was going to take care of me. No matter what, that's what motivates me and keeps me going, and that I know that God's going to take care of me. And that was the biggest part of it. Let your faith be bigger than your fear. You never know who you are inspiring.